Hey ladies! Welcome to a very special episode of the Health Revolution. Today, we're celebrating World Menopause Day. This day is all about recognizing and embracing the changes our bodies go through. We've brought together some incredible experts in the menopause space to share their wisdom and insights. First up, we have Tina Jacobs, a renowned menopause specialist. Remember her from our episode on hormone therapy? She gave us incredible advice on managing symptoms and finding balance. And who could forget our chat with world-renowned menopause specialist Dr. Mary Claire Haver? Dr. Mary Claire Haver shared some fantastic tips on how to nourish our bodies during this transition. Her insights on the importance of the newest menopause research were just invaluable. We also had the pleasure of speaking with fitness guru Clarissa Gannon. Clarissa inspired us with her optimistic approach to food and movement designed specifically for women over 40. She reminded us that staying active is key to feeling vibrant and healthy. And let's not forget the emotional side of things. Rochel Marie Lawson helped us remember the blissful aspects of our lives even through menopause. Her advice on self-care and mental health was truly heartwarming. Each of these amazing women brought something unique to the table, helping us understand and embrace this stage of life with grace and confidence. And we also have Jennifer Redmond, a fertility and hormone health expert. Jennifer shared her expertise on maintaining hormone balance and fertility health during menopause. So, on this World Menopause Day, let's celebrate our strength, our wisdom, and our journey. Remember, menopause is not an end, but a beautiful new beginning. Thank you for joining Adriana Morrison, the host of the Health Revolution. Don't forget to subscribe and hit the notification bell so you never miss an episode.
Welcome to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. We reveal the science-backed strategies that truly work in a sea of fads. We explore the physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who've conquered life's health challenges. Are you ready to unlock your potential to live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome to the Health Revolution. Now, if this is your first time joining us, I'm your host, Adriana Morrison, and today we have a very special episode in honor of World Menopause Day, October 18th. Now, we'll be revisiting some of the incredible guests that we have had on the show, experts and trailblazers who are redefining the menopause space and changing the conversation around women's health. In this episode, we'll dive into some of the episodes that have touched on the powerful impact menopause has had on women's lives, sharing knowledge and insights that every woman can benefit from. Did you know that menopause often hits earlier than we think? The median age is 51, but perimenopause can begin in the late 30s and even the 40s. 8 to 10 years prior, it tends to be the onset of perimenopause. Now, it's estimated that there are roughly 75 suspected physical symptoms associated with perimenopause that women can experience during this time. And these things include hot flashes, mood changes, sleep disturbances, frozen shoulder, just to name a few. Yet, it's a topic that we often don't talk enough about. The data is constantly evolving, and today we'll not only review what we've learned, but also discuss the emerging research and the incredible advancements in menopause care. So stay tuned, because we're about to dive into some of the most eye-opening episodes that we've had that address the challenges, solutions, and inspiring stories of women navigating menopause with strength and resilience. Now, we're starting off by revisiting a segment with our previous guest, Tina Jacobs, from season 1. Now, she's a certified physician associate and a certified weight loss coach, as well as the owner of Sylph Life Medical. Now, Tina has made it her mission to help women over 40 regain control of their health, specifically focusing on balancing hormones and achieving the ideal weight through bioidentical hormone replacement therapy, also known as bio-HRT, medical weight loss therapies, and health coaching. Now, her own journey, struggling with weight gain and fatigue despite being active, led her to discover hormonal imbalances that were the root cause. And in this clip, Tina shares how detailed lab testing and personalized medical treatments can lead to life-changing results for women who are struggling with similar issues. Now, let's take a look at how she's transforming lives.
And one of the biggest things is so many women don't realize it's their hormones. Like you mentioned, how important this is for women in perimenopause or menopause, but a lot of women in perimenopause don't even know that's what's going on. By age 40, 90% of women will have symptoms of perimenopause, and not even related to that, because symptoms can be vague, like just feeling more tired all the time, just having more anxiety or depression, gaining weight when you weren't gaining weight before. And so really, that's the message I want to get out most. And that led to me starting this business where I get to connect with so many women and get them the answers they really need on a daily basis.
I love how I love how you transitioned into really furthering the cause. And one thing that I realized for me, okay, so I'm 50, but the how women in my family have been, they enter menopause later, and it didn't occur to me to think about that in detail until very recently. Can you talk a little bit about, menopause and why this isn't something that is often talked about, but maybe slowly emerging these days, of things to look out for us women?
Yeah, exactly. I mean, in traditional medicine, we're still waiting for you to completely see that sharp decline where you're getting the hot flashes, the night sweats, those really sudden changes where your hormones, a lot of your sex hormones are close to nothing. And really, menopause doesn't happen overnight. It's a slow process. Testosterone starts highest, in your 20s and slowly declines once you reach age 30. And estrogen will slowly start to decline in your 40s. And then when you get to menopause, that's when it's at its lowest and you're noticing those most severe symptoms. But that's part of the reason it's not talked about, because it can be so many vague symptoms, like anxiety and depression, for example. If that starts at age 40, it's probably not a chemical imbalance. It's probably more related to your hormones, but still nowadays that's just being addressed with, antidepressants and anti-anxiety medication. And so it's not really being addressed or looked at or flagged until a woman is 50 in most cases.
Why do you think there's a lag with the clinician, the clinical environment? Why do you think that this has been just something that just is not up to par with society, with women in society and our needs?
Well, I think there's two things going on. I think one is it's a cause that's really just women. We know if men were going through this sudden shift or like drop off in their testosterone, it wouldn't be something where we're just like, yeah, maybe we'll treat it. You won't have that drive at work. You won't have that energy. You won't, be able to maintain your weight. But, it's just part of life, and as women, we're not treated as equals in that way. We know that for men, there's medications, for treating dysfunctions in the bedroom. There's medications for, or FDA approved medications for treating testosterone decline. That's not the same for women. And with women, there's medications out there that have the same risks and the exact same benefits that won't be FDA approved because they don't see women enjoying the bedroom time as important as men enjoying the bedroom time.
That's shocking to me. I mean, when I think about that, and I've thought about that, it's you know, it's a little upsetting that
It really is.
this
You
imbalance.
know, there's definitely that imbalance. And secondly, it's safety concerns. You know, there was this very misleading data that came out after the Women's Health Initiative in the 1990s. So there was the Times Magazine came out with the cover, unfortunately, saying 25% of women who use hormones will get breast cancer. And if you saw that as a woman, you'd be terrified. Women were calling their doctors and stopping all hormone treatments. And, you know, this one article, I think, was probably the greatest disservice of all time to women's health. And what really happened there is just a misinterpretation of the data. You know, we know as scientists in medicine or in health that you can look at data and manipulate it a certain way to use it for a story, to make it more scary, to, you know, in make it that way. But the truth of the matter is that in the study, if they tested women, you know, from age 50 to age 80, putting them on hormones. And if you look at just the women in their 70s who had went through menopause and had no hormones for over 20 years and then restarted hormone therapy, some of those risks were slightly increased. And 8 out of 10,000 women, 8 more people than the compared group in their 70s got breast cancer. And so what this tells us, and what we can actually learn from this data, is that if you start hormone therapy in your 40s or latest in your 50s, you're not only don't have those risks, but the data actually shows you're less likely to get breast cancer and other forms of cancer. You're less likely to have hypertension or high cholesterol. You're less likely to have osteoporosis and breaking bones. You're less likely to have diabetes and insulin resistance. And so the fact that women, because of that one study, have been avoiding hormone therapy is the most, you know, thing that breaks my heart the most.
So do you think, so what's been the dialogue in the clinical setting over the years, or say over the last several years, of what other practitioners, what their take is? Do you feel like that there's more talk about it, that there's
Definitely.
more talk? So there is more talk. Can you say a little bit more about that? Like, what's
Yeah. So even like 20 years ago, I'd say most primary care physicians or OBGYNs were still like, you know, avoid hormones as much as you can, you know, just because of certain studies that came out. And nowadays, I'd say when I work with patients and their primary care providers, because a lot of times there is a need for an interaction there, I see about 60% are supportive of hormone therapy because they actually know the data. But there's still that 40% that are scared because this isn't their field of study. So they haven't really dove into that data. And it's really easy to have those misconceptions. And so over time, it's slowly changed as more and more studies have come out showing how not only effective, but extremely safe these products are, and how they actually prevent the most common reasons that women die from, like cardiovascular disease.
That's super true. Are you finding that there is still that element of limited optimism from other healthcare providers that more needs to be done? Is it still, do you think that some of it is based on like maybe the training that they've had, but that they've not chosen to study further into menopause?
That's definitely part of it. You know, I'm a PA. So as a PA, we get 75% of medical school in 50% of the time. So we're getting, you know, we're trained under, you know, the same curriculum as doctors. And in PA school, or in friends that I've spoken to with medical school, we're learning how these hormones work. We're briefly learning what happens at menopause and the couple, you know, medications approved by the FDA that are available. But we're not getting that deep understanding of what women really go through in perimenopause, postmenopause, and the treatments available. Part of the reason for that is if you're using bioidentical hormones, it's never going to be FDA approved because it's similar to a vitamin. Like, if not in effect, but in what the umbrella of, things like your over-the-counter vitamin D or other over-the-counter vitamins, none of those are FDA approved because they're naturally occurring substances, and they won't be trademarked and, made into a name brand product that would be approved and go through the process of the FDA. And so very similar, bioidentical hormones, which would be the safest form of hormones, aren't going to go through that process. And because of that, not going through that process won't be taught in medical school.
So where is the hiccup in getting to the ideal goal of having maximum options for women? Where's the hang up, say, with the FDA? Is it that we just don't, is that there's not enough studies and that we legitimately need more studies? Do you think that there's a level of reluctance to do a further dive? And so now we've got trailblazers trying to move the needle forward, and it's a story developing type of thing?
Yeah, I mean, I am still very hopeful that we'll continue to have more options more readily available than women having to go to outside of their primary care or OBGYN to really get all these options on the table. And I think a lot of it is, that lack of really knowing the data and having that education about these different options and the studies that have been done on them. I still talk to, doctors who will say things like, yeah, there's just not enough studies, or it's, the studies I've looked at is just not safe. The truth is there's over 10,000 studies on these bioidentical hormone replacements and their safety and efficacy. And so it's really, when you look at any natural treatment, that, you work with a lot, and it's much harder for the standard medical team to be like, okay, let's go and just change your lifestyle and, get on these supplements and all that. They're like, here's a medication, and we're still in primary care medicine. That's the direction we're still going versus looking at treating the root cause.
And this is huge because, we touched earlier on perimenopause being obviously the stage prior to. What makes it so vague that it's not, that it's something that maybe not a lot of women, or say, we don't have the vast majority of women understanding how perimenopause is affecting them, especially as they're entering, say, 40s and such?
Yeah. I mean, a lot of it is that it's not being brought up by their doctors. Doctors aren't addressing it until they get to that menopausal state. So a lot of women will just chalk it up to, like, I'm a busy mom, or I'm hardworking, I'm a busy mom. It makes sense that I'm tired all the time. It makes sense that I'm stressed and I can't sleep. But if these things start to happen, like, they weren't problems for you previously, or they were and they've gotten a lot worse, around that age, especially, after age 40, for some women, it can even happen a little sooner, then we know that it's related to those hormone changes most likely. And that's the last thing I would say about that is, we're not doing detailed enough testing. If someone comes in saying they have anxiety, we're giving a medication. We're not testing, like, oh, could this be caused by low testosterone or an adrenal imbalance, or, a early thyroid dysfunction?
Do you ever, so as you see women coming in, and obviously they're from different backgrounds,
Yeah.
different levels of support, what is the most common scenario that you see? Do you see, like, for example, more likely than not, women going, I have no idea where to begin, I feel like things are off? Or are you seeing more and more women be very concrete in describing their symptoms and what's happening? Or what has that been like?
Yeah, it is a lot of, getting that message out that it's not, it's not your fault, it's your hormones, because there's still a lot of women that don't realize that's what's going on. A lot of times they're searching for weight loss solutions and they come across me and they're like, oh, wait, like, that's kind of my story. I do exercise, I do eat healthy, but for the last couple of years, I've just been gaining weight. And so it's like that light bulb moment of, like, oh, this could actually be something just biologically going on with me that I could fix.
Don't go anywhere. We will be right back after this. Next, we are taking a look at our episode with Dr. Mary Claire Haver. She's a board-certified obstetrician and gynecologist, and she's a certified menopause specialist. Now, she's also a certified culinary medicine specialist and the founder of Mary Claire Haver Wellness, where she focuses on menopause care. Now, Dr. Haver has dedicated her career to leading the conversation around menopause healthcare, which is in dire need of change. She's also a New York Times bestseller. I have got her book here, The New Menopause, as well as The Galveston Diet. Now, in this clip, Dr. Mary Claire Haver shares valuable insights on the intersection of nutrition and menopause and how women can take control of their health during this phase. Now, this was from season 1, where I got to meet with her in person. Let's revisit her incredible approach to empowering women through menopause.
Today. So I began this journey, probably harken back to 2014, 2015. I was perimenopausal, more than likely, but I had been on birth control pills for contraception and treatment of a condition that I had for years. So I kind of my perimenopause was pretty much treated. And I was in my late 40s. My oldest brother at the time, my very oldest brother, died when I was 9 from leukemia. It's all part of my story. And then my next brother was very ill with hepatitis and HIV. And Bob, we got the call that he had had a stroke and I had to rush home. And at the same time, I had stopped birth control pills, and after discussion with my practitioner, to see kind of where I was at in my menopause state. Was I fully menopausal? Was I, did I have a few more years left? And in my rush to go and take care of my brother, I forgot my own health care. I just went home. My sister and I did his end of life care, and he ended up passing away, within a week or so. And then I went into a really tough time of depression and, questioning myself and our relationship, and was having really hard time sleeping, waking up multiple times of the night. I was gaining, weight in strange places that I had never gained weight before. And I just really attributed everything to grief. And certainly that was a part of it. But I was gaslighting myself from my own menopause symptoms. I mean, I was having hot flashes. I was having disrupted sleep. I was having brain fog and anxiety. And so once the depression and, grief cloud was lifting and I was feeling like, okay, I can get on with my life, the other symptoms remained. And I thought, oh my gosh, I'm in menopause. Like, I haven't had a period in 6 months, and I just totally forgot. So at that point, I was always one of those girlies who thought that I would have this like magical menopause, that I wouldn't have any symptoms, and because I was so healthy and, I was exercising and trying to eat right and everything. And here I was with this inner tube around my waist, not sleeping, acne, losing my hair, like all of these things were happening. And I thought, oh my God, I'm going to have to be one of those poor people who has to take hormone therapy. And started HRT, got, but the weight wasn't, it was still struggling with the abdominal fat. So for the Galveston diet, my patients, so I had worked in a small community and I was aging with my patients. We were all kind of in the same phase of life. We had babies together, and then we're gaining weight together, and we're all having symptoms together. And we're all counting calories, and we were all working out together, and it just kind of stopped working. We were healthy, but we couldn't figure out what this abdominal weight gain was. So I called up the PhD nutritionist at the university I was employed at. I was like, what is going on in menopause? Everyone's complaining of this. I can't beat it no matter how many times I go to the gym, no matter how much I restrict my calories. And they're like, well, there's a lot to do with inflammation. Menopause seems to have a connection, but we don't have a lot of research in this area. So they just threw a bunch of medical research articles about inflammation, weight gain, visceral fat. I never even heard of the term visceral fat before. I could feel it, but I didn't understand the medical consequences of it. So through reading all of these research articles, I started there's a lot of great information here on fasting, not so much for weight loss, but more for lowering inflammation. I realized that I was inflamed. The headaches, the joint pain, the loss of sleep, was significantly contributing to this. And what could I do outside of hormone therapy, because that's not for everyone, to help with this? And so then I started looking at Mediterranean diet and some of the anti-inflammatory nutrition principles, and then finally started looking at macro and micronutrients. Went back to school at Tulane and got certified in culinary medicine because this became my quest, and decided I made a prescriptive little program for my patients. And it didn't have a name. It was not the Galveston diet. It was just, here you go. I made this up. See if it works and let me know. And I was making copies at the local Office Depot. My patients started sharing it with their girlfriends. It was working great for me. My girlfriends wanted to know what I was doing. And then I started talking about it on social media. And that's when it really kind of exploded. And so I started running these test groups in Facebook, private Facebook groups. And I would ask for volunteers from my little followers. Hey, who wants to try my program? Me. I put 100 of them in a group every month, and I would coach them through basically what the book is about. I made little slides. Everything was homemade, just me having fun, doing something on the side. And through a year of that, about 1,500 people I took through the program, they gave me so much feedback on what was easy to understand, what I needed to explain better. This was too technical. We need some meal plans. Here's some recipe ideas. And then it just all kind of came together. And so finally it was getting so big on social. Someone, a physician entrepreneur friend was like, you should do something with this. I was like, no, I have a good job. You should, you're reaching so many people. It's really starting to resonate. You should really turn this into a book or a program or something. So I tried an ebook, and that was a disaster. That was not the right platform for me, because it really took me kind of in video explaining. And so then someone suggested a online course, and I go, what's that? And they said, oh, there's these courses you can take online. You video everything, and you can make slides, and it's you talking. And I thought, well, that might work. So I launched the video course and I named it Galveston Diet after the place where I was living and where my kids were growing up. And just said, well, we'll see what happens. And within 6 months, we had done over 6 figures of, and people were sharing it. It was growing on social media. Then kind of what started evolving is the more I'm talking about nutrition and menopause, inflammation and menopause, weight gain and menopause, more menopause questions were coming in, and the conversation got bigger and bigger and bigger. And I kept reading and reading and reading. And I thought, we're not serving the menopause population and OB-GYN as well as they could be served. There are so many gaps in my own knowledge, and I was a straight A student. I blew the top off the boards. Like I thought when I graduated from my training program that I knew everything about menopause, and I knew this much. And It really sadly took me going through it and realizing that there's a huge vacuum here, and to kind of develop kind of where we are today with Galveston Diet and now Menopause Life.
Wow.
So.
And honestly, your journey is incredible, because it's very telling where we are. And how have you seen the medical community? What's been the input even from when you were becoming a board certified OB-GYN, and then just all the points along the way? What did you notice about the community, and then just your revelations with menopause?
So this is a big tell, and this is something I look back with shame, but I have tried to grow and learn from it. So it's a story I tell freely, but it is really one of the saddest things that I can think of how we treat women in medicine. And there was a great story in the New Yorker, I don't know if you saw it, where they talked about 2 different patients. One was a woman of color and one was a white man. And they came in with the exact same complaints and the exact same diagnosis. And the picture was a male physician with a stethoscope on her head and a stethoscope on his heart. And how often so many of our symptoms as women get attributed to psychological reasons rather than a true physical cause. And part of where menopause has been left behind is that only we go through it as women. And sometimes men just can't relate. It doesn't, you're just getting older. This is a part of aging, rather than this dramatic change in our health span and lifespan. If women did not go through menopause, if we were like men and had some decrease in our sex hormones, but really they can reproduce till they die, right? And so if that happened to us, it would dramatically change our lifespan and health span, from the diseases we would eventually die from. Our risk of cardiovascular disease dramatically increases after menopause. Our risk of osteoporosis, which we've known, but our risk of mental health disorders, our risk of autoimmune disease, all of that changes as we age. So here I was, a resident in the clinics, and we had this kind of gynecology clinic that was a catch-all for everything, discharges, whatever complaints. And there was a code name that we used for a woman who came in and maybe she wasn't sleeping well, or she had some aches and pains, and she was gaining some weight and her hair was changing, and it was called a WW, which is a whining woman. And if she was Caucasian, it was a WWW, a whining white woman. And so you'd have your chart and be like, you pick it up and because that was what we were, and it didn't go in the chart. We never would write that in the chart, and that was just like lore that was handed down. And I have to catch myself to this day when I start listening to a list of complaints to not automatically assume that it's stress or aging or anything else. Like, I need to find the root cause of this for her and help her, and certainly those things can contribute, but we don't do that with male patients.
Where do you think the deficit is in, say, the medical community and say women just reaching out, going, I don't even know where to start? Where is the gap of all of that?
I think it's a systemic issue. So There's not one thing. I think it is how we view women's medical issues, and this is, if there's a great book called The Unwell Woman, and it talks about the history of medicine from a female health perspective. One of the things is that in many health conditions, we've always just, human beings were considered to be the same. And anytime that a woman typically presented different than a man did, like her set of symptoms, it's considered atypical. Like, what a male goes through is the standard as far as his symptoms of a heart attack is a really good example. A woman doesn't have chest pain, shortness of breath necessarily. She may have jaw pain or something radiating or indigestion or whatever, and that's atypical chest pain, whereas it's how a woman usually presents. And so that has been taught since the dawn of time. If you look at, as far back as, Socrates, that, the wandering womb and humors and, anything to do with our gynecologic issues was just shrouded in mystery and related to basically the word hysterical. Hysterectomy is from the womb.
That's true.
Hysterical comes from the Greek, the Latin root for the word uterus. That's why we have a hysterectomy.
Yeah, that's true.
And even, in 2023, physicians today are recommending hysterectomies for menopause. And it just,
That's wild. I never knew that before. I never knew that this was something that's
outside of the menopausal women's surgical needs, OB-GYN training programs, and I was a program director for 15 years, have very little education around what can be done for them. But fortunately, menopause.org has grown and has wonderful resources available, but it's outside of the usual OB-GYN curriculum.
That's true. And for the viewers, menopause.org is the North American Menopause Society's official website. And so that's a powerful
resource
for women and even men who are supporting women as well.
Exactly.
What have you noticed in terms of debunking myths about perimenopause and menopause? How does someone who even a woman that doesn't understand yet the chronological path that many women take, where does one begin to study like what's happening to the body and all of that? What will help those?
One is to understand that there are estrogen receptors in every organ system of our body. And it's not just hot flashes and night sweats. So that's like myth number one, that it's just hot flashes and they'll go away, and they will go away eventually. And that it can start as early as your early 30s. So the average age of menopause is 51 in the US, but normal is still 45 to 55. And menopause is defined as one day in your life. And it is 1 year after your last menstrual period, if you still have a uterus. So it represents the end of your ovaries, sex hormone production forever. Basically, our ovaries, the glands we're born with at birth, we're born with all of our eggs. They start developing when we're embryonic, and they max at 5 months of pregnancy, okay? And so if you think about it, your grandmother had your genetic tissue carried inside of her when your mother was in the womb.
That is wild.
Yeah.
That is so, I've never
And
thought
so,
of that before.
whereas a man in the testes, they make their sperm fresh every day. Their gonads,
Right.
and their germ cells is the technical term. So, whereas we're born with ours, so we have a stock supply, and they age and deteriorate from birth all the way through. They start ovulating at puberty. We lose 1 a month. At least 1 a month, probably more. And then when we're about age 30, we're down to about 10% of our egg supply. And at age 40, typically we're down to about 3%.
Okay, I never knew those stats.
So when you think about the genetic variation and the environmental causes of earlier, surgery, radiation, different things, in the environment that can make us go through menopause earlier. So 45 to 55 is still normal, and menopause, like when your body's recognizing, like, hey, we don't have as much estrogen as we used to. This monthly ebb and flow, this symphony that we go through every month is starting to. Things are starting.
You say symphony, I feel like it's more like noise.
Start 7 to 10 years before your period stops. So a 35-year-old woman absolutely can start showing signs of estrogen depletion from perimenopause. And that's, being told you're too young. I mean, that is an absolute myth.
So the language that's being used in women having these conversations with their healthcare providers, what have you noticed in terms of what are you hearing from your patients and other women that is the breakdown of communication?
So there are certain physicians that are just did not receive the proper education and training or any, and are getting into the hormone, world, and just categorically dismissing even a conversation. This is part of aging, get over it, move on. And not recognizing the suffering that could be alleviated or the improvement of our overall health. And so that's one issue. 2, there's a lot of bias that people are, you should do everything natural. You should, and I think it's because men don't have something similar. The process of menopause is natural, but it doesn't mean that it can't be pathologic. There are a lot of things that are natural that are very pathologic, or that we seek help for. Presbyopia. I can't see very well without my glasses, but no one looks at me. And a famous example is erectile dysfunction. That is a normal part of aging. And no one gets upset, other than maybe his wife, about, the use of medications to help with that. And so it's like a double standard, and we're on the bad end of it.
So in terms of the training, so you mentioned that the training is just not quite where it needs to be for physicians.
Right.
What's been the conversation like amongst colleagues?
So a lot of us are, especially, my colleagues and I, we were mostly female in my residency program. So there were 8 of us. Well, actually, they're almost all female now. But we were probably, I think we had 5 and 3 by the time we graduated, 5 women, 3 men. And we're all still friends, several of us. And so, the texting back and forth of, wow, we need to learn more. We need to know more. We need to be able to do more to help these women, where we just really thought, oh, well, give her HRT if she's dying, and because we were so worried about perceived risk of breast cancer, which is totally was blown out of proportion. So it turns out that hormone replacement therapy is massively helpful and safe for the vast majority of women. And so many women are being told that they're not candidates when that's just not true.
How does a woman have that conversation with her healthcare provider if that's the feedback that they've been getting, and she's been with him or her for
so let me warn your followers that your doctor who took care of you and delivered your babies and was this awesome resource for you for so much of your life may not be your best provider for your menopause.
So you mentioned before about the same physician, the same provider who had delivered their child, and things are different nowadays. And that how does a woman transition from from, say, a provider who was helping her in a previous chapter,
Right.
and now things are different and we got to revisit the landscape?
I wrote an entire blog about this, and I have resources, and we can put it in the link,
Yes.
of how to advocate for yourself in menopause and how to have a conversation around HRT, because your healthcare provider may not be informed. And so I have linked the menopause.org guidelines. I have the ACOG, the American College of OB/GYN guidelines, and then I have the article from the American Heart Association, which debunked, and then a couple of articles that talked debunking the cancer, myths. And so that has, the feedback I've gotten from providing that resource to my followers has been tremendous. But say you don't even know, I would always call ahead before you waste your time, and unless it's someone you have a great relationship with. Go on in and ask, if you happen to be in there for something else, like, what's your stance on hormone replacement therapy? Do you really treat menopausal patients? And they'll usually tell you right up front, or ask to speak to the head nurse, and she'll tell you. And so what do you do if they say no? You're just categorically denied, no conversation had, I don't believe in it. Well, it's not Santa Claus, by the way. So there are other resources. So the menopause.org has a list of certified providers on their website. Not all of them are fabulous, but it is a place to start. You're more than likely able to find someone. We have a list on our website as well that were recommended by my followers on galvestondiet.com, and they wrote testimonials, so you can maybe see if there's someone in your area. If you're in Houston, you can come see me, or one of my providers. And also, there's some now great telemedicine options out there available, companies built to serve menopausal women specifically.
What's been the dialogue, or how has the dialogue changed as you're talking with others within the medical community, and more and more people are getting to know your trailblazing efforts to really change the landscape of how we approach menopause as a society?
So it's been neat. Most of the feedback I've gotten from fellow providers, and it's mostly through DMs from social media, have been very, very positive. Like, thank you so much. I'm learning from you. I've changed my practice patterns because of you. I read the articles you recommended. I'm getting certified from NAMS, North American Menopause Society. Like, I see a need here. If there's any negative, they're just talking amongst themselves and keeping it. I'm sure there's who does she think she is. She just wants to be a TikTok star, but really my focus on social media is simply to educate so that you make decisions for your own healthcare based on facts and not fear.
And I'll tell you, I love what you're doing on social media, because I think that you're using the platform just to have some really, truly relevant conversations and just putting that input out there. That's how I first discovered you, and I thought, wow, this is a woman who is really resilient in helping the rest of us just live better as we're moving forward. So I think, many flowers to you for doing that. One of the things I wanted to talk about was in terms of going through perimenopause and menopause and the sometimes dicey conversation of HRT. What is the best way for a woman to approach hormonal replacement therapy, and what can help her decide if it's best for her based on her history?
Sure. So when we look at any medication in medicine, your healthcare provider's job is to discuss the risks and the benefits as they relate to you and your personal health history and profile and your needs and wants. And as long as the benefits outweigh the risks, then you together make a shared decision whether or not you're going to proceed with that. And I think what's missing out of the conversation around hormone therapy in most healthcare providers' offices is the risk of not taking it. All anybody talks about is the risks of taking it, rather than what happens if I don't take HRT. Well, you're going to die sooner. You're more than likely going to have a fracture, and within that fracture, you have a 25% chance of death, within a year, okay, of a hip fracture. And you will have a dry, painful vagina and not be able to enjoy intercourse, for most of us, more than 50% of us, as we get older, you will have a higher chance of depression and anxiety. You have a higher chance of cardiovascular disease and death from cardiovascular disease if you don't start within the recommended ages. And so we are not just, I am, but that is the conversation I think that is lacking in the risk-benefit profile of what happens if I don't take it. Okay, well, you're not going to live as long. You're more likely to have heart disease. You're more likely to die earlier from heart disease. You're more likely to have a fracture and die from a fracture. All of those conversations need to be had as well.
Are there contraindicators
Absolutely.
that are within
like any medication, like Tylenol and ibuprofen? Not everyone is a candidate. And so who is actually, and I can talk about the myths here as well, the absolute contraindications to, and when we talk about hormone therapy in menopause, we're talking about estrogen plus or minus progesterone. Testosterone is a separate conversation, okay? So specifically for estrogen, if you have an estrogen-sensitive cancer that you are actively treating, you should not be on hormone replacement therapy, okay? If you have an estrogen receptor breast cancer, if you have any breast cancer within the last, that's been treated in the last 6 months, you should not consider it. Does that mean everyone with a history of breast cancer is not a candidate for hormone replacement therapy? No.
Okay, so that's good to know, because sometimes you hear that women
there are patients who are well recovered years out from their, they've done their chemo and their radiation, and they've had their whatever treatment, and they've been told categorically that they cannot ever take hormone replacement therapy. Estrogen does not cause breast cancer. It might feed a breast cancer, but it is not the cause. Otherwise, pregnancy, our hormone levels are as high as 5 times our normal reproductive lives, and less than 0.0001% of women get breast cancer in pregnancy. It's possible, but it's extremely rare. So you have to have breasts to get breast cancer, and estrogen might feed the cancer, but it is not the cause. So women who are on hormone replacement therapy at the time of their cancer diagnosis are diagnosed earlier and have higher, less, 20% chance less of death than a woman who was not on it at the same time. These are things we're not telling patients. So your family history of breast cancer does not rule out that you cannot have hormone replacement therapy.
Wow. Okay.
So another is if you have undiagnosed vaginal bleeding. Okay, any abnormal vaginal bleeding, sorry. So if you are having irregular periods, some spotting, and you haven't been evaluated for that, it's not the time to start hormone replacement therapy. Now, it may be perimenopause that is causing your cycle wonkiness, but until you figure out if it's polyps or, or perimenopause or whatever, you shouldn't start hormone replacement therapy until that gets worked out. If you have had a blood clot within the last 6 months, most experts are recommending, let's get that worked up, figure out why you had a blood clot, and let's wait 6 months before we consider starting. But if you have had a blood clot more than 6 months ago, or you have a clotting disorder, or the MTHFR gene or whatever, you are still a candidate. We just do transdermal instead of oral. Oral only carries the increased risk of clotting, not the other ways of getting it in your body.
Wow, this is good clarity. What is there a window period in which a woman can take advantage of HRT? Like, say, if
you can have a hormone replacement therapy at any point of your life.
Okay.
That is still your decision. But there are windows of opportunity where you will have more benefits for cardiovascular disease and Alzheimer's and dementia than you were, and that's when you start very close to within 10 years of your menopause. So as long as you start early, so there's something called the healthy cell hypothesis, where estrogen is such a powerful anti-inflammatory hormone in multiple organ systems of our body, and it's very protective. And so it is why after menopause, our heart disease risk approaches a man's, where before we were protected. Our bone density, if you get on HRT, before you miss your estrogen, you will have strong bones for much, much, much longer. Your risk of osteoporosis will be that of a man's. And so there is a window of opportunity. Now, once heart disease has started, you have coronary artery disease, you have Alzheimer's and dementia. Those are not the times to start hormone replacement therapy because estrogen added to those situations, it's too late. It's not protective and it may actually be harmful.
Wow. So then what's the best approach? So the conversation to have with physicians, like say you have a perimenopausal, you have a woman, or even a woman that's entering menopause, and she wants to delve into this, but the doctor has not approached her about this.
All I can say is, once you hand them the evidence, you can go to my website, download the articles, print them out, and take them. And patients have done this, and say, tell me the reason why I can't have this, and they still fight you. You need a new doctor.
Wow.
They're not going to be on board with you.
Wow. And why do you think that is? Do you think it's because they're so that maybe that they feel that the training that they've had is certain and that there's no other additional training?
You know, we're all supposed to undergo continuing medical education, but unfortunately, and I'm calling them out here, the American Board of OB/GYN, that's who board certifies us and keeps up our certification every year, rarely has a menopause article. Rarely is putting the articles in front of the docs saying, this is important, we need to keep up with this. It's almost never. And so, you know, again, it's a systemic issue. And if you're not trained, how can you possibly, you know, and the way our insurance system works, there's no code in Medicare for menopause.
Never knew that.
The wellness exam for a woman after the age of 65, according to Medicare, is screening for breast and cervical cancer. Nothing else. They're not paying for menopause care.
Wow.
Insurance companies, it's a conversation. So in my clinic, I don't accept insurance. I let them use their insurance for their prescriptions and everything, but they will not pay me to take that hour and sit there with a patient and untangle all of her menopause story and make sure it's not hypothyroidism also and autoimmune disease or whatever. You know, I've diagnosed lupus and lots of things in my clinic. And so, you know, do body scans, talk about nutrition. And so when we talk about menopause care, I want to be clear here, it's not just hormone replacement therapy. You know, that is something that is one tool in your toolkit. So when I talk about my menopause toolkit, right, there's multiple, it's like the caboodles when we were kids, you know, if your mom was lucky enough, if you were lucky enough to get your mom to buy it for you. And so in the most important box in that toolkit is nutrition.
Agreed.
And that is something that 98% of physicians know nothing about. And that's not their fault. You know, they have an undergrad in biology, and then they went straight to med school. And so we are taught little to nothing about nutrition. I went back to school to be able to write this book and learn this. The next important thing is exercise. So moving your body and not just burning calories. We need to stay strong. We need to build muscle. We need to hang on to our muscle. Sarcopenia is coming after us, the loss of muscle mass with age, and it accelerates in menopause. So, you know, when people come in complaining of weight gain in menopause, and I was one of them, it is more about the loss of lean mass and the gain of visceral and abdominal fat and how that makes you so much more unhealthy. So nutrition, exercise. Then we talk about pharmacology. Hormone replacement therapy or not, or other. You know, we have other medications that might treat your hot flashes. We have other medications to keep your bones strong. We have other ways to keep your vagina healthy that don't include estrogen if you're not a candidate, but actually everyone is a candidate for vaginal estrogen. So, you know, that big conversation. And we talk about supplementation. You know, if there are gaps in her nutrition, or we think maybe turmeric might be helpful for her inflammation and joint pain, and it helps with hot flashes as well. So we talk about that. And then we talk about stress reduction, because again, we're human.
Yeah.
We're stressed out, you know, and we need to get a handle on that, putting up boundaries. You know, it's tough. I've got aging parents. I've got a little past teenage years, girls, and I'm taking care of both sets, you know. And so that's a unique position we're in our lives, and that can cause a lot of stress. And then we talk about sleep optimization and how much that has changed as, you know, we've entered this phase of our lives and how important it is. And so doctors are really only taught pharmacology of that toolkit.
Do you think that maybe there's an apprehensiveness because it's maybe unknown territory, that maybe it's bigger than what anyone
I think I can tell you from my personal learning, knowledge, experience, this is so much bigger than I ever imagined. I didn't understand what the loss of estrogen would do to a body. You know, I knew that the hot flashes, I knew the night sweats, I knew the vaginal changes, I knew the genital urinary stuff, I knew the osteoporosis. I didn't know about the Alzheimer's and dementia. I didn't know about skin changes, hair changes, nail changes, gut changes, the gut microbiome, that, you know, like how it, and then it all just puts you into this negative feedback cycle where we lose our resilience. I mean, most of my patients come to me and they were high functioning individuals. They were rocking their lives. They had stress, they had problems, they had all the normal stuff, and all of a sudden they can't handle it anymore. And nothing's changed in their environment, but their loss of estrogen.
Wow, that's incredible. I want to throw something out at you to get your take. So I had wondered about, of course, the concept that we understand, like, say, Karen, right? And just the
WWW.
Yes. How much of that, like, say, when the media, when there's different, when, say, someone is painted as a Karen and who we perceive, like, who might fit the mold, how much of the menopause journey could be contributing to why, say, that woman is maybe having a hard time in that situation and it was wrong place at the wrong time, or, aside from extreme cases, but how much of the menopause journey might be contributing to, say her?
So I've wondered that myself when I see some of these videos, and one, it's a very high place of privilege where you can act like that in public. There are other people who don't have that opportunity to be able to get away with it. They're not getting away with it because of social media, but for every Karen on camera, there's probably 600 who someone didn't have their iPhone out when the stuff went down.
Right.
So I don't know, but I've thought the same thing. Like, is she really just losing it because she is just at her wit's end right now, and this is how it's manifesting for her? And had we just provided more support, if she didn't go through this blind, if she didn't wake up with all these symptoms and be gaslit until she was crazy and it was all in her head and whatever, like this is what has happened. This societal way that we treat an aging woman is what's manifesting. I don't know.
I had wondered about that, and I thought, it's when you see when you see situations, or maybe like in person, where when you see a woman just having a hard time, I couldn't help but wonder, is she having internally, is she just struggling and everything is just not
too much? Yeah.
Yes.
And 10 years ago, she had the exact same environment, but she was fine. She would deal with it. There are some gifts of menopause, though. Like, here's what I've seen in my life and what I talk to my patients about. I've learned to put up boundaries. Like, I've had to prioritize myself, finally. Otherwise, I'm not going to make it. I'm not going to be the mother that I need. I'm not mothering my children anymore. They're 19 and 22. I'm trying to figure out this next phase of having adult children. But, like, putting up boundaries with people in my life who I let drag me down, hurt me, take me to negative places. And I know that I can't do that. I can love them from afar, but I can't let them into this space that I've created with my own family. And I talk to my patients a lot about this, about how they, and kind of my give a care factor to, what I'm trying to say, but has kind of gone away. You see it on me. You see it, I'm living it on social media right now, where I get on video and I don't have any makeup on, I'm still in my pajamas drinking coffee, and I just feel like I need to share this with the world, of whatever menopause fact that I want to share. And so I find that that's a gift, that I can be more of who I am and prioritize myself and my needs, because if I don't, I'm not going to do well. I might be a Karen.
Don't go anywhere. We will be right back after this. Next, We are revisiting our episode with Jennifer Redmond back in season 1. She's a fertility and hormonal health expert who empowers women to take a 360-degree approach to their wellness. Now, Jennifer is a certified integrative nutrition coach. She specializes in guiding women through dietary and lifestyle changes, and that is to help boost fertility or to manage menopause. Now, with her extensive background and as the co-founder and editor-in-chief of Fertility Authority, Jennifer has dedicated her career to supporting women's health in transformative ways. Now, in this clip, she shares her expertise in balancing hormones and creating personalized health strategies. Let's take a look. And this conversation is pretty powerful. Watch this.
There wasn't enough focus on wellness as it pertains to hormonal health. There's a lot of focus on illness. So I decided to pivot my career, learn about integrative nutrition, learn more about hormonal health. And I found that the way that I could have the biggest impact on women was working with them one-on-one and in group programs. And so that's what I do. I believe that women really need to be empowered. You and I have talked about this, really need to be empowered, really have to have the knowledge to know how to best support their bodies in these major hormonal and life transitions. I think for my colleagues in the fitness field, they're really tuned into the fact that the type of exercise that you were doing when you were younger doesn't necessarily support you right now. It needs to be more about movement every day and maybe not high intensity exercise every day. So it's really just getting comfortable with your body in this new phase and then learning how to support it. You don't have to be stuck with weight gain if you don't want to be. There are ways to eat and nourish yourself that's going to help with hot flashes, that's going to help with the brain fog. So it's really about giving women the tools and the information to empower them to make the changes that are going to be super supportive at this stage in life.
And I agree with that. I think that this is conversations like this really spark my interest because it doesn't seem like this was not something that women who were older than us, that this was often talked about. And
Right.
I almost feel like we're paving the way that this generation is of women, Gen Xers, and then older millennials, that we're having to deal with this and have much more prominent conversations with healthcare providers about listen, these are the things that are happening to my body. This is what I notice. This is the intensity. This is the frequency. Do you what has been your observation with medical providers who maybe it's just not universal across the board? What have you seen? What have you noticed?
Yeah. So like I said, I have a lot of women who come to me frustrated because they feel like their concerns are just sort of brushed aside. Like, yeah, it's perimenopause. That's what happens. I think that unless you're a nutritionist or are in some sort of field like that, honestly, your doctor just might not have the information. There's not, I've actually given lunch and learn seminars to fertility doctors to help them learn about nutrition, right? They're just not given that information in medical school. I assumed they were. They're not, right? So I think it's about, so I hear that the doctors are just sort of, they don't have the information. And so my clients just feel frustrated, the things that they were used to doing don't seem to work anymore as far as weight loss or just like I said, waking up with that brain fog can feel a little scary. Is this really perimenopause or is there something else going on? So I think, again, finding those helpers and healers who can support you in this stage, knowing that this just might not be your doctor's area of expertise.
So how does a patient, how can they have the conversation, or what are some examples of being able to initiate that conversation with their doctor if they're feeling intimidated? that
Mhm.
that maybe the doctors are supposed to know all, which of course we know that they don't know all. But what are some impactful ways that women can initiate that conversation if they're sensing it's going to be a challenge, or maybe that their doctor may not hear where they're coming from?
Mhm. So I don't think this is the answer you're looking for, but I'm always encourage my clients to get a second opinion if they feel like their doctor isn't a good fit for them. Maybe their doctor isn't a good fit for them. But if you love your doctor, you want to stay in the practice, you can keep a list of your symptoms, keep a list of when things are happening, and be really specific with your doctor. This is what's happening. This is when it's happening. And I believe I'm in perimenopause. How can you support me? Are there things you think I can do? Are there ways I can eat? Are there supplements I can take? Your doctor may or may not have that information. And if not, maybe you need to find a doctor or some other provider that does. But I think keeping track of when is the last time I had my period? How long was it? So sort of getting that own download from yourself, just starting to gather information so that when you go in, you're like an informed consumer, right? You've got your list of symptoms. You know when things are happening. This is when you've noticed you're not sleeping. This is when you notice you get hot flashes. This is the brain fog that I'm having and how it affects me, whatever it is. But going in really empowered with a list of things that are happening and when, and initiating that conversation with your doctor.
Don't go anywhere. We will be right back after this.
So NAD is something that we use for people who are going through withdrawal symptoms, whether it's opioids, whether it's alcohol. GABA receptors in our brain is something that alcohol affects when we drink. So when you're going through alcohol withdrawals and I give you the calm bag or give you calm with GABA in it, it kind of gives your brain that kind of fix, so to speak, of the alcohol to help with the withdrawal symptoms. I'm not saying it gets rid of them. I'm not saying I give you GABA and you're good to go forever. That's not what I'm saying. It's, again, just like everything we offer, it's a relief.
Now, let's take a look back at our previous episode from season 2 with Clarissa Gannon. Now, she is the CEO of Vegan Fit for Life. Clarissa started as a personal trainer, but her passion for helping women has led her to launch her online platform in 2014. And it's specifically designed to support women who want to pursue a vegan or plant-based lifestyle after 40. Now, with extensive certifications in fitness and nutrition, Clarissa has become a trailblazer in providing real resources for women who are looking to live healthier plant-based lives. So in this clip, Clarissa shares her expertise on vegan fitness and wellness. So let's revisit her impactful insights.
My relationship with doctors has never been very good. I had my one child at home. We never really had a primary. I had my one child in the hospital. The rest of them were at home. And so it was just, there wasn't the support. I feel like they don't do a good job of listening to you. Now, however, in the space that I'm in now, one of my very best friends is a doctor, and she's also my primary. So we do have good conversations. And while she doesn't particularly understand why I eat the way that I do, she does know that, like, my labs support that I'm in very good health. I have a low thyroid, and she does wish that I would use a different type of a thyroid prescription, but I won't because it's made out of pig. And I'm sorry, but I can't do that. But otherwise she's fully in support of the way that I eat. So when I went fully plant-based this last time, which was back in like 2016, I noticed that I had so much more energy and my recovery was so much more faster. It was so fast. It was ridiculous. I was stronger. So that was also, a really big bonus because you want to be stronger when you're lifting weights, trying to build muscle. But the recovery aspect was just great. Another thing I noticed that went away was a lot of the kind of low feelings, like I'm not going to say it was depression, but just kind of feeling low and kind of worn out. That also went away. So I fully credit that to being plant-based as well.
When you went prior to going 100% plant-based, were you mindful of nutrition in the way that, were you doing your due diligence in that animal protein and perhaps animal products were just the one area that you were homing in on? Was there any type of slacking that was happening that, maybe you would, was there the occasional fun foods? Did you notice a trend in how you were consuming? Did any of that have an impact on how your energy levels were, how you were moving, what you noticed your body to be responding to?
Right. Yeah, no, I've always tried to incorporate the fun foods. I think there should be balance. And I also think that if we can incorporate those foods that a lot of people think are off limits, it really helps to structure a nutrition system that is more sustainable for you. But there does need to be balance. Like we can't go out and have a hamburger, every single night. But if you have one, once a week or every other week or whatever, your body can actually use that better. And that being plant-based or not, as in the past, if I was incorporating those foods, generally what you notice, depends on where you are, like with your nutrition protocol, but it can be beneficial. And it was, as long as it's done in a mindful manner that, there's intent behind, and it's not just something that's cascading out of control every night.
What do conversations with your family look like today? Are you the only one who's plant-based, or are there others in your family that are plant-based as well?
The kids will eat plant-based with me. I mean, it's not a big deal. They're not going to go out and do it necessarily on their own now that they're all grown up, but they also didn't mind when I was cooking that way at home either. They've always been, and I fully, credit that to going back to how I cooked when they were small, that you get a very balanced meal. You get proteins, carbohydrates, and vegetables at your meal. And there's no reason why you can't do that being plant-based as well. So they've been good about eating that way. Now that they're grown up, I know they're making their own choices, and I know that they're probably not plant-based all the time, but they'll be like, "Hey, Mom, do you want to go to this vegan restaurant?" And I'm like, "Of course I would." So they'll go out with me, and that's been fun.
What about your family of origin? What about?
I don't know that they're no one lives here. My family is all out of state. None of them are plant-based, and I'm going to go out here and say, like, all of them have health conditions. Conceived idea that when you're plant-based, you're not getting enough protein, you're not getting enough vitamin D. What else? Oh, the B12. Those are like generally the three top things. And if you just are being aware of what you're eating, I always like to tell everyone, it goes back to being responsible for your own nutrition. And if you learn what you're eating and why you're eating it, you're never going to have a problem with any of those three things, because you're going to get what your body needs.
Yeah. How do you handle that skepticism or the hesitation?
With our clients, when they first come in, one of the very first things that we do is we do a gut map, and that's going to tell us the foods that are causing inflammation and the foods that are going to be beneficial for this individual. Very often, those gut maps restrict chicken or pork or turkey or something that the person is used to eating. And so then what we do is we swap it out for an approved plant-based source of protein. So the person is able to see, as they're going through this process, because they usually have to keep that food out for at least 60 days, they're able to see that they feel better. So then we can sometimes, incorporate more. Sometimes they're happy, with just leaving those things out. Sometimes they want to bring the food that we've, taken out, they want to bring it back in. And that's really up to the individual. More often than not, though, Adriana, I've seen that the foods that we take out like that, like one lady, beef was a hot item for her, and she wasn't supposed to have it. And even after we worked together for, I think she did 6 or 8 months, she didn't want to put it back in. She said she felt so much better without it. And I'm happy just doing that. That's still an impact, and that's still doing something.
So don't go anywhere. We will be right back after this.
Introducing Launchpad, the perfect partner to help you launch your dream project to the world. We know that time is of the essence, and we're here to help you make the most of it. With Launchpad, you'll get access to the most advanced digital tools and strategies to take your idea from a mere concept to a fully fledged success. Whether you're an aspiring entrepreneur or a seasoned pro, we have everything you need to make your mark in the world. Launchpad, your ultimate launch.
Now let's take a moment to revisit our episode from season 3 with Rochel Marie Lawson. I love this lady. She's a true trailblazer for women's empowerment and success. She is the CEO of All Cable Incorporated, which is the first women-owned, minority-owned telecommunications installation company in the United States. Now, Rochel has made a significant impact not only in business, but also in the lives of countless women. She's known as the Queen of Feeling Fabulous, and Rochel is also the founder of Blissful Living for You and the creator of Brave, Bold, and Unstoppable Women Summit. She is also an author, and this is an incredible time to check this out. Watch this clip. In being so successful in different areas of your life, were you also successful in taking care of your health, or was there ever a challenge in balancing your self-care with the type of energy you needed to be successful professionally?
So I did have a challenge with my health.
Right.
And it came before I had the tenacity. Well, I've always had the tenacity. I ain't gonna even lie about that. I've always had tenacity. But it came before I even really stepped into owning that I'm a brave, bold, unstoppable chick. And yes, I'm definitely commanding my empire. When I was 8 years old, I suffered 4 very traumatic things. And that began a period of me having a 17-year journey with my own health and well-being. I woke up every day in pain. I was always sick, but I learned to put on a good front. So nobody really knew how sick I was except for those that were close to me. And it was also during that time that I began to have these holistic practices be placed on my path in life. Even though I didn't know what they were, I began doing them. So yes, I did struggle for 17 years with very traumatic pain. But lo and behold, the holistic medicine and wisdom that was shared with me on that journey allowed me to heal myself in 9 months. And I got the gift during the meditation session. So I could definitely share more about that. But what I was diagnosed with, they couldn't diagnose me back then. Went to about 100 and something doctors, had my first pelvic exam at 9 years old. And I remember the doctor saying, I don't have anything small enough to examine her. It wasn't until I became a young lady and started having pelvic exams, I understood what he meant when I was 9 years old. But the beautiful thing about that is they now have a diagnosis, and it's called traumatic stress syndrome, and it affects children. It happens in children or young kids. And from these incidences that cause that traumatic stress, there are things that develop mine, affected my digestive systems. Others could be their respiratory, their immune, whatever it is. But stress is a real deal, and it can be extremely traumatic to our health and well-being.
Wow, that's incredible that you were able to overcome that with a period of time where you saw the light at the end of the tunnel with all of this. In 17 years, that's a very long time. Was this something that your family instilled in you, that we will find the answers, we will figure this out? Or it was just something that you inside determined, I'm going to get to the bottom?
It's so when I was going to the doctors, they could never diagnose me, but they were quick to give me some kind of prescription. And by the time I got to be 13, I was a freshman in high school. If you think I'm sassy now, I was extremely sassy back then. And I just started doing stuff. So one thing that was really bad though was I love sugar. So I was a candy girl. I like candy, cookies, sweets, whatever, but I stopped eating fast foods. I had began an affirmation practice, but I didn't know what it wasn't called that, but I began saying affirmations at the age of 10 as I ran track and field. And this gentleman, professional athlete, taught me that. I began utilizing visualization because I wanted to feel better, but I also wanted to make my mark in whatever I was doing. I wanted to be the best. I was down low, very competitive, but out front, very vivacious and engaging and social. And so over the course of my journey, it was all these little things: not eating fast food, meditating, visualization, saying affirmations. I began doing detoxification. When I was a teen, I had no acne, and I began doing herbal packs and stuff. I had no idea what I was doing, but I know I didn't have any acne. And so all my friends began to come over, and I started giving them facials and clearing up their acne. So it was all of this stuff. I started getting massages. I would save my little money when I was like 15 with my little job and get me a massage when I could afford it. Of course, I buy shoes because I have a shoe fetish, but get me. And it was just all these things that by the time I was 25, I was already a nurse. I already knew what my diagnosis was, but I didn't want to take any pharmaceuticals. It's just not me. And during the meditation, I got the download of everything that I had been doing probably since I was 10, but it was in a sequential sequence. And I just followed the sequence because I was at that point, what do I got to lose? I'm in extreme pain every day. Some days I can eat spaghetti and some days I can't eat spaghetti. I can eat chicken and the next day the chicken made me be in a lot of pain. So I just got tired of trying to figure it out, even though I was eating healthy. You know what I mean? And that download during that meditation was a game changer. I just said, nothing else, let me try it. In 2 weeks, I started feeling less pain. By the end of the month, it was like, oh, okay, I'm feeling pretty good. I always had the energy, but I was feeling like really like naturally energy. And as the months went on, it was better till the 9th month. I had absolutely no pain, and I've been pain-free since. So I say I suffered for 17 years. I was baking a baby in me, and I delivered that baby within 9 months, and that baby has been gone and grown up until right now. So I'm so blessed, and I'm so happy. But it's what I learned on that journey that I share with ladies today.
And what I love about your story is that there's a level of proactivity in your voice that was beyond your years. So you chose to be innovative. You chose to be self-innovative before it even became a thing that we're looking at and we're exploring today.
Yeah, it's funny when you say that. I'm like, yeah, she's right. Although I never gave up my candy, my sweets.
Oh, yeah, talk about that, girl.
That too. I gave up the fast food, but I kept eating the candy, the cookies, cakes, all that stuff. To this day, I still love that, but I have way better control of it. Way better control. But yeah, I think, I guess I was innovative. I just knew that I didn't want to feel bad. And particularly when I became an emergency room trauma nurse, it was like I'm sharing this wisdom with my patients and watching them have dramatic changes in front of my eyes. And so it's like, maybe there's something to all of this. Maybe if I could just put it in a sequence, then I could feel just better. I could wake up 3 days in a row without any abdominal pain, and be able to eat some healthy food and not really suffer afterwards. And so it just, like I said, it was a succinct, stepful journey that the divine put me on and led me to the gift that I'm able to share today.
Wow. Now I want to put a little health-related spin on it. How can you be fierce and fearless with your health and any medical barriers that come up in terms of limitations, diagnosis, and things like that?
Oh, girl. Okay. So first of all, I want to say, I'm still a registered nurse. I'm licensed in the state of California and Texas. I'm no longer practicing emergency room medicine. Just got a little bit too old for that. But I'm going to keep my license probably until I'm 85, until they tell me I can't have my license renewed anymore. The thing about it is what I saw in my practice was that people aren't assertive with their health and well-being. They can be very complacent, and they will leave oftentimes not really understanding the true fullness of whatever diagnosis or whatever situation they were in the first place. And so I would always tell my patients, do you understand what the doctor, well, no, I still have a couple of questions. Well, let me get them. Oh, well, no, they're busy. No, the most important thing in your life is you. If you don't stand up for your own health and well-being, what makes any of us think that somebody external of us that's not suffering inside like we are going to stand up and represent us? So I say, 1, be assertive, ask questions. It's okay to ask questions if you don't understand, and you keep asking those questions until you get clarity and confirmation. 2, if you don't believe a particular diagnosis, don't settle and be like, okay, well, I'm just going to let this doctor treat me for this. seek out other opinions, because you never know what someone may have a gift in, another person may not, and they may not be able to see that particular challenge. So pay attention to what you're putting in yourself. Lots of green leafy vegetables, green juices to 5, detoxification. We absorb so many toxins in our food and the air and just the clothing we wear, everything. So you got to practice regular detoxification, because when you clear out some of the toxins, you'll feel uplifted. Your cells will be like buzzing like that Maserati driving down the freeway, just coasting, just hitting them bumps and just rolling along. And you build up your immune system. The key to having longevity is to have a healthy mindset, a healthy immune system, and to pay attention to the little subtle things that you tend to blow off that might not be something you should be blowing off. And like you said during your commercial, uterine health and ovarian health, women, if you don't hear nothing else I share with you today, take this away. Please put yourself first. Please be assertive with your health and well-being, and don't be afraid to ask questions until you get the answer that satisfies you and your curiosity.
And that wraps up this special episode of the Health Revolution. Now, thank you for joining us as we revisited these empowering stories and expert insights. Remember, you can catch the Health Revolution every week on Roku TV, Amazon Fire, Apple TV, and the E360 network, airing at 10 a.m. Pacific, 1 p.m. Eastern. Also, we see you, LinkedIn. And don't forget to subscribe to our channels on YouTube, LinkedIn, Facebook, and Instagram. And for more updates, visit thehealthrevolutiontv.com, our website, where you can also subscribe to our newsletter, and you can email us with any show episode ideas that you would love for us to conquer and to share with you. That is all the time that we have. Remember, October 18th is World Menopause Day. And for those of you women who are out there, please understand and recognize that we are just growing into our new level of strength. I'm proud to say that I'm 51 years old, and it is time to shine, ladies. That's all the time we've got today. Until next time, take care of yourselves. We will see you soon.